obviously, I think it does play a very integral role in understanding our future progression into preventive cardiology, which is a very critical facet of addressing what's essentially become an epidemic on its own, right? In the country, not only my country, but globally speaking, of course. But when looking at this, how does it lay out our next steps of assessment beyond just long-term assessment and interpretation?
Well, FH as a disease is underdiagnosed.
Yeah.
We estimate, it's not us, which I estimate that it has been published that 15%, maybe 20% of FH patients are diagnosed and know their status to start with. And this is a real challenge, particularly in countries other than Western Europe and North America. In the Hauser study, there were 23 countries involved, 5 continents, but 85% of participants were Caucasians and 2/3 coming from Western Europe, and approximately 20% from North America. And the reason for that is because the screening programs are more advanced in these countries for different reasons historically. So the challenge is to make sure that the adequate FH diagnosis is available everywhere in each country, in any continent, and not only among Caucasians. That's important.
Yeah. Wow. Yeah. I mean, that's certainly what you're looking for, right? Is some universal addressers, and just looking at exactly how far the PCSK9 inhibitor class has come in about a half decade of marketed use and understanding valuation. Obviously, another part of that too is its role as an add-on therapy, right, with statins. When we're looking at that, particularly, Doc, is that something that is addressed in the pediatric population, or is that something that's...
Well, that's an interesting question. First of all, most FH children and adolescents will be adequately treated and controlled with an optimal use of statins with or without ezetimibe. But there is still a subgroup of individuals, affected individuals, for whom a residual risk or an important risk exists because of their family history of very premature cardiovascular disease, because they are not adequately responding to optimal treatment, or because they not tolerate these treatments. So the PCSK9 inhibition here plays a very critical and very well-known role. I mean, it's a very exciting, it was right at the beginning when we discovered PCSK9 as a target, very exciting. So on that side, it was important to first assess, well, in those who might require it in the pediatric population, is it safe and is it effective? And well, Hauser study really suggests that it is very well tolerated and it's effective.
Yeah, wow. Well, that's great to hear. Well, Doc, that's really all I had for my planned discussion around Hauser. I wasn't sure if there's anything else you want to expand discussion on regarding the PCSK9 and class evolocumab, or just these observed patient populations.
Well, PCSK9 as a target, inhibiting PCSK9 is, when it has been discovered again, it was probably one of the most exciting target to control high cholesterol levels. If ever PCSK9 has been discovered before LDL receptor, I'm quite sure that the standard of care would have been using PCSK9 inhibitors first. Having said that, the real challenge of the next years is to continue to improve our knowledge of the safety and efficacy on in larger cohorts, and also from a familial approach. I'm combining, and it's obvious, life habits, the use of statins, and then making sure that everywhere in any continent you have access to accurate diagnosis and accurate treatment. And PCSK9 inhibition is certainly part of actually the toolbox to treat FH adequately.